Niaz Suban wakes up every single day to a myriad of physically painful COVID-19 symptoms. However, he is not COVID-19 positive and hasn't been for more than a year. Yes, he was diagnosed with the disease on March 29, 2020, but after spending 50 days in the COVID-19 intensive care unit, he was medically cleared of the disease on May 17th of the same year. So why is he still living with the debilitating effects of COVID-19? Well, he, among millions worldwide, continue to suffer the long-term effects of the disease months and even years after they have recovered. They are referred to as COVID long haulers, and the condition is dubbed long COVID. Even persons who only experienced a mild form of the disease, which did not warrant hospitalization, can also suffer its long-term debilitating effects. In an exclusive interview with Nightly News on Wednesday, Suban detailed that over the last 4 months, simple everyday tasks like climbing the stairs has become a grueling challenge for him. This is as a result of body aches and difficulty breathing.
The actual difficulty sometimes, I would say, in breathing. I don't have to have an aid to breathe, thankfully, but I know there are times when I have to really push harder, and that wasn't happening before.
To further exacerbate his condition, Suban has been running on a maximum of 3 hours of sleep at nights, which has taken a toll on his mental well-being. The joint pains can be excruciating and has caused a limited range of motion in his right hand. Daily headaches are also on the list of the many agonizing side effects of the disease he continues to endure.
And they had started to do physiotherapy while I was in the hospital, and that continued for about 2 months after I came out of hospital. So thankfully I now have the use of my right hand, but what I find now is that the left hand, I'm having a problem with my left hand in terms of limited use of my left hand. I mean, I could use it, but there are certain things I cannot do, like I can't put my hand behind my back to sleep. In hospital, they had to give me a sleep aid. Now it's difficult to sleep without having a sleep aid. And even when I take the sleep aid, I'm not sleeping, getting the desired amount of hours that I should have.
Suban eventually sought medical attention for the symptoms, where it was discovered that he has a scar tissue on his lungs.
I am on medication, but at least I had to go to that extent for them to explore to see what's happening.
His case remains officially undiagnosed as long COVID has not been given much attention locally. In other parts of the world, countries have established specialized clinics just to treat COVID long haulers. Suban was asked whether the establishment of such a facility locally would assist his condition.
I believe if there's enough data to suggest, and there's enough people who are, well, not enough people, but if the ministry believe that they're seeing that kind of a pattern, I don't see why they would not do that. As a matter of fact, as I said, Dr. Anthony was the one who explained to me about the long COVID and whatever, so it's something I would not rule out.
Head of Medical Services at the Georgetown Public Hospital, Dr. Mahindra Karpan, acknowledged to this newscast recently during an exclusive interview that Guyana has witnessed several cases of long COVID. So how is the local health team treating with this relatively new subset of patients?
So we treat with them just like we treat with them in any other disease. Tiredness, a lot of psychological support and counseling is involved, a lot of understanding in the workplace, at home, etc.
An estimated 10% of coronavirus patients become long haulers globally. Temika Rodney reporting for the HGP Nightly News.